Good afternoon, everyone, and thank you for joining us at the Astrodyne TDI Returning to Work in Public Spaces Forum. My name is Chris Viola, and I'm the Chief Executive Officer of Astrodyne TDI. I'd like to welcome you all to today's presentation, where we're going to explore topics we frequently get asked around how do I safely return to the work environment? How do I safely go out into public spaces now that the pandemic is upon us and we have the stresses and anxiety of our lives for doing that? We thought we'd put together a panel of experts in this area to answer your questions and try to help you to improve your situation in the open work environment. So I have Dr. Manuela Hamaoui with me and Dr. Angela Lis. They have graciously volunteered their time to join me today as your host and try to answer some of these questions and provide help to the people and our colleagues that work with us. So doctors, welcome to today's presentation.
Thank you. Good afternoon.
And without further ado, let's jump into it. Dr. Hamaoui, do you want to start?
Yeah, sure. So what Dr. Liz and I did, we did comb through some of the CDC and WHO guidelines to try to help sort of filter that and help you apply it to your day-to-day. And our hope is that this will help you navigate our society safer and maybe dissipate some of that anxiety of going back to work.
That's exactly correct. We just want to make sure that we all understand that going back to a new normal requires for us to retrain ourselves, because we want to minimize the spread, and this is the best time that we can help each other, because all of the recommendations that we're giving today are really to protect yourself, but at the same time to protect others, your coworkers, your family, and your loved ones. And one of the best ways to really start is understanding a little bit more about COVID-19. What are the things that we know so far? And the most important thing that we have learned is that it spreads easily, all the time, through every single droplet that can come out of a person. So most of the recommendations that you're gonna hear from us today is really how to control the spread. And we need to make the basic assumption that every one of us can be spreading the virus, even if we are completely asymptomatic.
Well, fantastic. So if I have to retrain myself, what should I do? Where should I start?
Well, in the name of science, I'm going to start with the demonstration today.
Okay.
This is something worked well for my children, but what I'm going to do is I'm going to COVID-fide my hands today for you. And I'm only going to touch my face 10 times during this presentation. Maybe at the end, you might notice how only those 10 times might have gotten COVID everywhere. So here's my COVID today. For the sake of science, here it is, a lot of glitter.
All right, so the COVID is the glitter today, Dr. Hamaoui.
Yep.
Okay.
So you can see now my hands are pretty COVID-fied, and we'll see how I do with the rest of the presentation today.
Excellent.
And I think what Dr. Hamaoui is going to do is extremely important, because if we understand that the virus is literally like a droplet that is overly covered and protects itself, it can really live everywhere for many hours, actually. So it can live in your hair, it can live in your glasses, it can live in your face, in your clothes, in your shoes, in your workspace. So what we really need to do is to retrain ourselves to kind of like build a safe zone for each one of us to try to prevent those droplets to be around, because they can spread the virus very easily.
Excellent. So start my retraining. Tell me what I need to know, doctors. I can't wait.
So one of the first things that we did, and actually that's how we arrived today, has to do with wearing the mask. You know what I mean? And when we talk about the mask, we need to find out not only which one is the best mask, but how to wear it. And one of the main messages is to really use all the time the earpiece and avoid touching the mask. As Dr. Hamaoui was saying, the droplets can be everywhere, but they also fall in the mask. So if you touch the mask from the front, the mask is losing all of the, the protection that it needs to be given. When we wear the mask, what we are doing is preventing our droplets to come out. It's not much of the droplets from the outside to come in as it is the droplets to come out. So the mask is a protection that I am using for you. So if by any chance, you talk and your droplets fall on me because you don't have a mask, and then I touch my mask, then I'm losing all of the effectiveness of the mask. So first message, really always take the mask from the side You know what I mean? Place it on the side. If it's a disposable mask, goes to the garbage. If not, watch it every day.
And what's also important during that handling, because the virus enters our body through our eyes, nose, and mouth, it's really important about protecting these surfaces. And so anytime you're touching things, especially your face, you want to make sure you're washing your hands before and after. If you're eating, if you are touching your hair, those things close to your eyes, nose, and mouth, you really want to be cognizant that your hands are clean when you're doing that.
Excellent. I've already made that mistake a couple times of touching my mask. So now I know I got to touch from the sides and the ears, stay away from my mask, my face, try to retrain myself to not do those kinds of things. But honestly, I see masks everywhere, all kinds of masks. I didn't even know what a gaiter was until someone explained what the gaiter was. Are all the masks the same? Is that oh, here's a page on the mask. Okay, go ahead. What do I need to know?
So there's definitely a few different types of masks out there. The most common and the one recommended by the CDC is the cloth masks for us to go out in the community. And just like Dr. Liz mentioned, this one is really to protect the droplets from an infected person from traveling outside. It gets caught in that mask, sort of like that picture on the left side there. And so that prevents those droplets from traveling very far. The other two types of masks that you might see is the surgical mask, which is this one right here. And what it's acting like is sort of like a raincoat in that it can prevent those droplets from entering your nose and your mouth. But as you can see, there might be some voids in there. It doesn't form a seal around your mouth. And then respirators are those I-95s that you're seeing. Those are really intended for healthcare workers and first responders who are getting exposed to aerosolized virus. So these are during intubations or any manipulation of the throat or a cough or something where they're really close to someone who may be infected. So it's not really intended for the public use.
And I think if I may add, most of the masks need to have a very good fitted into the nose and very good fitted right here at the chin level, because we don't want any droplets to come out from any corner. So you need to make sure you have a fitted nose, a fitted chin, and you need to make it as fitted as you can to the side. The masks that seem to work the most are masks that have more than one layer, because if it only has one layer, it doesn't seem to protect that much. Usually I do a really nice exercise, which is I have a candle, you know what I mean? And if you light the candle and you try to blow it with the mask and the candle doesn't go off, then you know it's a really good mask.
That's good.
Okay, and that's something very easy that you can do at home, especially now that a lot of people are going back to work and you don't know which mask is the most appropriate or not. So remember, very well fitted, and remember that the purpose of the mask is to protect your droplets to come out. So in few words, the mask shouldn't be the only thing that we need to be using, because the mask only seems to work when the other person is using the mask as well, and when we have social distancing, because these droplets can travel for a very, very long distances.
So the gaiters and the face shields, you don't recommend those. They're less effective. And if I see someone in a gaiter face shield, I should assume I need extra distance between us. Is that what you're saying?
That is correct.
Okay. Or I may have to even ask them, could you do you have a mask, or is that rude?
Well, the face shields, sometimes they're used for people that have disabilities. So, in some cases, face shields may be appropriate because they don't have any other option. But in most of the cases, the face shield does not replace the mask. So if the other person is using the face shield because of disability purposes, it makes sense that you go farther away because you want to protect that person. Remember that what you're really trying to do is protect others when you use the mask. Okay. So the face shield has a lot of space, so then there is no full protection or as much protection as you have when you use the mask.
It's really only intended to protect, droplets from entering your eyes. In terms of it preventing COVID from entering your airways, it's probably not as effective.
It's very helpful. Thank you. So I know how to put on my mask. I know not to touch my face. I'm going to stay away from people wearing gaiters just a little bit. But if I'm outside and I'm 6 feet away, can I take my mask off? Is that okay? How close can I get?
Well, the evidence has shown that these droplets can travel. Okay, we know that if you are outside, it's much better because you have air, so the likelihood that it's gonna fall just one path towards you decreases.
Okay.
So it's much better to be outside, but the recommendations really is that even if you are outside, you need to maintain the social distancing. It's a combination of the two. It's not one or the other. And if you are at work and if you're in a confined space, well, then you absolutely need to train yourself to be using the mask at all times. Unless you are in a safe zone, like your house, you know, and when you control all your environment, that's a moment when you can remove the mask. But if you are not in your safe zone, the recommendation is to use the mask and to maintain social distancing as much as you can.
So just like Dr. Liz mentioned, you know, the CDC has made recommendations that a mask should be worn anytime that you're in contact with people outside your household. And so that can be indoors or outdoors, and social distancing is just another weapon we have to prevent COVID infection. And so we should use everything in our arsenal to try to prevent that.
Well, it's funny that you mentioned the work environment and how people work together, because I'm still attending business meetings, and it's uncomfortable, right? You used to be shaking people's hands. Actually, you've had people demand to shake my hand or to be persistent. And so I'm just wondering, you know, from a business perspective, how do we manage that situation? I have my mask on, I'm in a closed environment, I know I have to social distance. What are my options?
So we've definitely come up with a few different highs and hellos. You know, there's the distance high, the little nod, the wink, foot kicks and elbow kicks. If we can at all avoid contacting each other, I think that's for the best and maintaining that social distancing. But, you know, at the end of the day, it is through our eyes, nose, and mouth that primarily this virus is entering our body. And so if someone happens to give you their COVID hands, just remember that, you know, as long as you don't touch your eyes, nose, and mouth, and that you wash pretty quickly after that, you know, you should be safe.
Okay.
You know, Chris, I need to be honest. Many times people is gonna just send the hand and try to shake it. And I think that the best idea is to have Purell next to you and train yourself to wash your hands all the time. Because it really, I mean, there's sometimes when you can just avoid it. And the idea is not to be all the time freak out of having people around. It's completely the opposite. It's to retrain yourself. And I think that if we kind of like review what retrain means again, wear your mask, social distancing, wash your hands. And if you cannot wash your hands all the time, be ready and carry your Purell. We were talking before, I create for myself a kit, you know what I mean? And I carry the kit with me all the time. And that kit has an extra mask, has Purell, and I also carry Clorox wipes. Okay. So every single time that I go out or I go to the bathroom or something, I take my wipe, you know, I use my wipe to open everything, then put it in the garbage, next day replace the one when I go out again. And I have my Purell with me all the time. It's just a matter of being trained rather than to be scared, because we don't want people to be overly anxious. This is gonna be around for a little bit longer. So we need to start to feel more comfortable, but not relaxed. Comfortable enough that we can have a small, you know, a smart position to prevent the virus to spread.
So I know we have to move along, but before we leave, I have to ask both of you, and I haven't tried many of these, which is your favorite greeting besides a handshake? I have to know.
I'm the thumbs up.
2 thumbs up, Dr. Hamaoui. You're which one?
Kicker.
The finger. I think I'm going to try the namaste next time. I might try that. I haven't tried that one. So is there anything else I can do to help my colleagues stay safe and my fellow employees as we come to work every day?
Well, I think that if you can think about this as the best opportunity to really fight the virus, being careful with your health will be kind of like the next step. You know what I mean? You really, really want to make sure that you create a safe zone, and that safe zone can be your home, So you need to make sure that when you go back home, you know, you leave your shoes outside, you change your clothes, you go and you take a shower, because it can be in your hair, it can be in your clothes, and you want to maintain your family healthy. The same way, when you get into your office, you want to make sure that everything is clean, you organize, you have the Purell next to you, you have your mask, you have your kit, and at the same time, you try to prepare for the day. And if preparing for the day implies to bring food from home, then that's preparing from the day. You just need to be ready.
And I think I agree with Dr. Liz. It's really the training and the practice of making these things happen. Like you're seeing during this video, I'm just touching my face really quick for a little itch in my nose, but you know, that could be the moment where COVID takes the opportunity. So it's really putting those things into practice and doing that every day that's going to help you, you know, keep yourself safe.
Okay, so I don't know if my car should be considered a safe zone. I'd like to consider it a safe zone, but I was out doing some shopping the other day, and when I was coming out of the shop I was at, they ran out of hand sanitizer, and I had a moment of panic of there's no hand sanitizer, which means how am I going to get my hands? Now I'm in my car, I'm touching things in my car, I have to get to my sanitizer in my car, which is in the glove box, etc. Is there anything I do to try to prevent that?
So again, having those things handy, for example, in my car, I have a little basket on the passenger side that has all those things, so that immediately when I come in, it's very easy to just grab that without touching anything else. I'm very cognizant. I have, you know, if possible, one hand I try to maintain clean, the other is the one I use for doors, money, key, things like that. And so, you know, I'm very cognizant of what I've touched, and being practical about having access to your alcohol without touching a million things. So your glove compartment is probably not the best idea.
Okay, I'll make that change.
I think that the more that you are careful, you know, with your hands, the better it will be. And I think that that's like the main message. This is the main source of germs all the time. Because even if you cover your face, but then you touch it, then the germs will be here. Or then you use your glasses, and then you're touching your glasses all the time. So you just need to be careful. Always wash your hands when you go back home. Wash yourself. Clean up your glasses all the time. Because, as I said, it has the ability to really survive for quite a long time. So we want to make sure that we don't spread the virus either. So my main suggestion will be every single day that you finish your day, change of clothes, choose outside, go to your safe zone, and just think about it in that way. I do the same. I carry a lot of things in my car to make sure that when I go back home, everything is really clean. So my family is never at risk.
All really good points. Thank you for sharing so much. Is there anything I need to know about the disease, or can I do anything to help myself prevent, in an unlikely event that I actually contract COVID? Is there anything I can do to improve my personal situation?
So we're still building our understanding of why some people do so well with COVID and can be completely asymptomatic, and while other people, even young and without medical conditions, can do really poorly. But we do know that if you do have medical issues, that you have an increased risk for complications and severe illness. So really maintaining those things in check, making sure that you're following with your doctor, your diabetes, your hypertension, your asthma, everything is well controlled, but also remembering to do those preventative visits, because we definitely saw a decline in that, particularly in the beginning of COVID, making sure we're doing our cancer screenings and our immunizations up to date.
I mean, we understand that people are scared of going to the doctor's office because they don't want to get sick. But what we know right now is that people are also ready to see you as a patient. So a lot of doctor's offices now have a system when you can wait in the car until you're ready to go to the office. It's not as crowded as before. They're keeping everything very clean and organized. So the best thing that you can do right now is be in the best shape that you can. And if that implies do your yearly checkup, do all of your vaccines, especially the flu this year, have a pretty healthy nutrition, exercise, anything that implies have a good health, that's the best that you can do. Remember, we're all susceptible. People that are extremely healthy or people who are having a lot of comorbidities. Everybody is susceptible. So, you know, at this point, you just need to be ready. I need to be ready to have it or to protect yourself in both directions. But the key point is everybody is susceptible, so don't try to just avoid it because you are afraid. This is not being afraid. This is really being smart and learning from what we know so far, which is not much, but is good enough to control the spread.
Yeah, I'm certainly one of the ones that were guilty. I was definitely reluctant to go back to my doctor early on in the days of the virus, but I'm feeling, you know, less anxious about it every time. And with all of these pointers and tips you're providing to me, I'm certainly, I feel better about going back. Is there anything else I can do to boost my immunity?
Definitely your nutrition is a key factor. Anything you're putting into your body is going to help you. So your vitamins that you get through your vegetables and fruits are particularly helpful with not only helping your immune system, but also reduce the likelihood of developing other chronic medical conditions and keeping those in check. I tell my kids to eat a rainbow of vegetables every day because each vegetable color has a different nutritional component. So if you want to try that out, I'm all for it.
I've heard that before from my doctor. I don't think that's new information, though. My doctor's been complaining about my eating habits for a long time, Dr. Hamaoui.
And now's the time to start working on those.
I'll have to, point taken.
But you know what, Chris? I think that what you need to learn this time is that we have learned that those people who have obesity, diabetes, or high blood pressure actually have lower likelihood to recover from COVID. And or when they recover, it takes much longer time to go back to their normal life. So maybe it's a good opportunity, a good motivation to really be in better shape. Because again, obesity, diabetes, high blood pressure, specifically obesity and diabetes seems to be a huge problem for patients who have become symptomatic with COVID-19. So if nutrition is somewhat difficult for you, then think about activity levels, because we also know that exercise can help a lot with your immune system. So vitamins, especially vitamin D, helps with your immune system, but exercise can do it as well. So that you know, both things that are easy to do, especially when you go back to work and when you're at home.
Now you're talking my language. I can definitely increase my exercise every week. That's something I really enjoy. What do you recommend?
Well, you know, we know that exercise can boost your immune system and can also increase the response of your body to vaccines. It's something called immunosurveillance. Right? To be honest with you, we just want you to exercise. Just keep yourself active. We recommend more outdoor exercises because it seems to be safer. If you go to the gym, you're gonna be breathing harder. There is a lot of moist air, there is a lot of turbulence air, so then we can create more droplets and they can stay for longer time. So it will be much better to exercise outdoors or to exercise at home. There's so many apps and new things that you can do at home that's actually a great solution. Now, if you choose to go to the gym, I will first make sure that in the area that you are, the transference or the disease rate has decreased. Second, that the gym is really trying to do the best job that they can in maintaining everything cleaning and that everybody really is using the mask. Otherwise, the recommendation will be just to increase your level of activities outdoors or use apps or you know, all the Mirror or the Peloton, anything that you have at home.
So just like Dr. Liz said, I agree, you know, we are all being maybe a little more sedentary because we're home, or the opposite, right? We might have the opportunity to be working out more because we are home. But take it in bite size too. You know, you don't necessarily have to start with the 150 minutes per week. I would actually recommend starting, you know, slowly and building that habit over time and just seeing how your body responds to that. But any exercise is very good.
I'm actually walking my dog 3 times a day now. Never did it before. And I'm feeling better than ever. I'm making myself walking long walks 3 times a day.
I'm sure your dog appreciates it as well. Well, Astrodyne TDI is certainly a responsible corporation, and we are actually giving away several devices, Pelotons, the mirror. You can select, if you just come to our website and register your name and email address, we'll be giving away these devices over the next few months, trying to help people to exercise, encouraging them to stay in shape and fight this disease, and try to help everyone to enjoy as much as possible the life we're living as we survive this pandemic. Thank you, Doc. I'm sure both of your doctors support this.
Absolutely.
And feel free, doctors, to register yourselves. Good luck. It's a random drawing. Anything is possible. So if you win, we can maybe eventually I can come over and share it when the device is gone. So thank you, everyone. Any other final thoughts, doctor, before we wrap up for the day?
I just want to make sure, remember, the key to protect yourself and others is mask, social distancing, hand washing, and try to keep yourself as healthy as you can. Keep up with your yearly checkups, exercise, sleep, try to maintain yourself active. We are all in this together, but there are a lot of things that we can do.
I think Dr. Liz said it all, but I just wanted to show you my 10
I want to see the glitter. I want to see the glitter, Dr. Hamaoui. Wow. You're covered in COVID.
Glitter.
You're covered in COVID.
So I'm going to de-COVIDify now and do a lot of hand washing and probably a shower.
Okay, I think is there one more slide, Dr. Liz? All right, so we have our first question. It's from John for Dr. Hamaoui and Dr. Liz. And John asks that he's been having difficulty finding antibacterial wipes at the store. And is there any alternatives to the wipes if they're not available when he goes, specifically the Clorox wipes or the Lysol wipes? I don't know the answer to that question, so I'll defer to Dr. Hamaoui and Dr. Liz. What do you guys recommend?
I think that's a great question. We are all struggling to find even alcohol or antibacterial, antiviral wipes. So the CDC actually posted some recommendations there. You can actually look them up, but I believe it's about 4 teaspoons of bleach with 1 quart of water that you can prepare at home. Just buy a spray bottle from your typical online shopping, and you can mix that up, or you could actually find 70% or above alcohol that you can use instead. I have both solutions at home. You just kind of have to be careful about how you store those things. Obviously, the alcohol is flammable, so in the summer particularly, you don't want to leave it in your car. Make sure kids can't reach that substance. And the bleach actually is recommended that you mix it for 24 hours, and after that, toss it in the CDC recommendations.
Any preference there, Dr. Hamaoui? Is it you prefer bleach or alcohol, or it doesn't matter?
I use both. So for my surfaces, I use the bleach. Just know that it's going to ruin any, colored cloth that you use it with. So be careful with that. And for my hands and stuff in the car, I use the alcohol.
Excellent. Thanks for sharing that. Next question is from Caitlin. And Caitlin wants to know, how can I keep my glasses I wear glasses, I guess. How can I keep my glasses fogging when I put on my mask? I have this problem too, Dr. Hamaoui. What do you recommend?
It will really depend on the quality of the mask that you have and the little metal piece that it has on your nose bridge. So if you can get a nice pinch there and a seal, and when you press it down really close to your cheeks and your nose, you should have less of that fog coming up to your nose. But it also tells you how well of a seal of a mask you have. So if you're getting a lot of fog, that probably means that there's a lot of air coming up into your eyes. You can also, if you have goggles or glasses, there are anti-fogging solutions you can buy online, and so that can be helpful too.
Okay. So Cheryl asked Dr. Hamaoui or Dr. Liz, is it still recommended to clean your groceries when you purchase them before you bring them in their house, or is that optional now and you can just bring the groceries directly into your house and put them away?
Great question, Chris. What I can tell you is that, the main way that this disease is spread is, again, through respiratory droplets, so coming in through your nose, mouth, and eyes. Touching surfaces is probably the least concerning, but we do know that the virus can live on surfaces for quite a while, even days. And so you can choose whatever you feel more comfortable with. So I definitely know some people who are wiping everything down. I'm guilty as one of those people, wiping everything down and bringing that into the house. The other option is just being aware that your things can have COVID on them. So just if you wash your hands whenever you touch that box or that vegetable and you wash it well before you consume it, then you should be fine, as long as, again, your hands are clean and you're aware of that. I personally just, want to be comfortable at home and not have to think about that. So that's why I do it that way. Also, some people are quarantining their things at home. So you have a little closet where you keep things for a couple days and then you switch it to your pantry. That's another solution. But again, this is probably the least concerning transmission type.
Thank you. Okay, and last question is from Charles. Charles wants to know if it's the correct procedure for eating safely at work. Oh, that's a really good question. So I'm back at work and now I have to eat. What am I supposed to do? Dr. Hamaoui, what do you recommend?
That is definitely another great question. So a couple concerns there. I love eating out at work and ordering in on one of those tight schedule days. That is something you have to, think about where your concern is. What I can tell you is a recent study did show that people who eat at restaurants are about twice as likely to test positive for COVID. And it may not be necessarily how the food is prepared, but you can consider, all those surfaces that can be touched and manipulated and contaminated during that process. So your cups, your plates, your food, everything can be contaminated. So I would recommend, if possible, to prepare your food at home and then consume it at work. The other concern there is, we used to all get together in our little cafeteria and eat together, and it was a great time to socially bond and talk about things and, let work be out of our heads for a little bit. And I'm not sure at this point we can really do that. So I would recommend eating outside if at all possible, or isolated to a room by yourself. But whenever you're taking off that mask, you have to be cautious of what is around you.
So really eating by yourself is the best practice while you're at work if possible, whether in the car or in the cafeteria. Okay.
Definitely would recommend that.
Okay. Thank you very much. And that is the end of the questions.
Great.
Okay, so thank you so much, Dr. Hamaoui, Dr. Lis. I learned a lot today. It was very educational. I feel much more comfortable about going back to my workplace. And as we conclude, I want to thank our audience, both our customers and our suppliers, for coming today. All of you, good luck in your chance to win the Peloton or mirror. And as we leave, I want to just remind you that we're the one-stop shop for power supply and EMI filtering needs, and a nice suite of products here. We service consumer appliances, high-end appliances, industrial products for the kitchen, exercise equipment, both for the gym and for your home. And please think of us the next time you need a power supply or filter. Have a great afternoon and stay safe, everyone. Thank you, Doctor.
Thank you. Have a great day.
Bye-bye.
Bye-bye.